As promised, this is part 2. Part 1 was a discussion about Gen X and the millennials and the higher cancer rates and which cancers they had a higher rate of. This is your cancer screenings. And I did break it down into ages because I just thought, I think that would be like easier for you. Yes, I'm going to adjust this a little bit. I want you to get a really clear view of what I'm talking about. So here we go. Let's look over here. I put cancer screenings. Again, I'm Dr. Shelley from HETV, Shelley's Nursing Review. I do have to say that. I thought about it. I'm like, oh, they don't know who the fuck I am. Okay, so here we go. Cancer screenings. Notice I wrote 12 to 30-year-olds. Oh, yeah, because if you'll remember, when we looked at some of the higher rates of cancer that you were dying from if you were 30 to 55 years old, testicular cancer was in there. So you start screening for testicular cancer at 12. So I put 12 to 30-year-olds because in this section are all the cancer screenings that someone in that age group needs to be focused on. Obviously, cervical cancer is one of them. Now, I got good news on this front. Cervical cancer is decreasing dramatically because of the HPV vaccine. I only wish that I could have got the stupid vaccine when I was a kid. I have been blessed. I don't have HPV on my pap. I've never had HPV, but I'm just thinking that, would have been a good thing at that time. Now, so that's a big success rate for the HPV vaccine. We've almost gotten rid of all cervical cancer. We're still screening for it in people who never got the vaccine. But again, it's a good vaccine story, okay? Because I know some of y'all on some bullshit, but whatever. Here we go. 21-year-olds and older to 30, right? So if you're 21 and older, you should be getting PAPs every 3 years, okay? Now, if you're 30, we kind of go up a little bit on our screening. We add an HPV test to your PAP. That's done right at the time of a PAP. Now, some of you get confused. When I say PAP tests need to start at 21, you go, that's crazy. These kids out here bumping and grinding and fucking and doing all this shit. They got all kind of STDs. How they gonna wait till 21 to check them for coochie problems and crotch rot? You're confused. I said PAP test. I did not say pelvic exam because a pelvic exam needs to be done every year in sexually active teenagers. Women, of course, you get a pelvic exam on a male, you call me because we're going to both be rich. What I'm saying to you is some of our people out there, women and men together actually, I have noticed, because I was an OBGYN for 20 some odd years, you confuse PAP test with pelvic. No, I said PAP test. That's a test for cervical cancer. It's a screening test, okay? So when we're looking at getting a PAP test every 3 years, starting at 21, that has nothing to do with who needs a pelvic. You need a pelvic every year if you're out here doing whatever you're doing. And maybe you're out here doing it as early as 10, 11, 12. I delivered a 10-year-old's baby, 7-pound, 9-ounce baby boy, and it was consensual sex, if you want to believe that. Okay. Now, 30-year-old, HPV and their PAP test needs to be every 5 years. Okay, this is at least in the patients who have never had abnormal PAPs. I've never had an abnormal PAP, don't want to have an abnormal PAP, so this would be me in particular, okay? So this is for people who've never had an abnormal PAP. Now, you heard me mention the HPV vaccine. Remember, it's for boys and girls, and if you get it before you ever get exposed to HPV, which is the goal to give you the vaccine before exposure, then you would get it around 11 or 12 years old, and you would only need 2 shots. If you wait till 15 and older, you're going to need 3 shots. But if you get it early, you're going to only need the 2 shots, okay? This is a junior high type of thing, so that's why I put that there. It is boys and girls. Now, once you hit 65, why is we doing PAPs on you? Or if you had a total hysterectomy, you don't need your coochie explored all like that. Sit down somewhere and enjoy your life, hunty. You're fine. You don't need to keep coming in here for no coochie checks. Now, skin cancer, I want to say something about because it is really underestimated how serious skin cancer is. And there's 3 types. There's basal, squamous, and malignant melanoma. If you got half a brain, you know that word malignant means deadly, right? Mal, French for bad. Malignant, bad, horrible, deadly. Malignant melanoma killed one of my patients. She was 27. I delivered her baby. So, I'm about to go there with you, okay? Because here's the deal. Skin cancer, especially in women, is most likely going to be found between the ages of 15 and 30. Now, you should be screening for it all the time, but I'm saying 15-year-olds and up need to take a look here at their skin. And we call it self-skin examinations, where you're going around and looking at your skin. And I always tell my students to look at this here, traditional wooden pencil, right? Number 2 pencils. School supplies are coming up. Parents, you know what the hell I'm talking about. I want you to take a little peek at this eraser tip, huh? The eraser tip on this pencil is the size of moles that need biopsy. So if I go like this to your mole on your arm and it's outside of my eraser tip, your ass need a biopsy. I go like this, and I can still see the mole, biopsy. 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 Remember, everyone, that biopsy is the only way to diagnose cancer. So this mnemonic that we like for skin cancer is A, B, C. I add a little D and E. That is for you and me. A, B, C, D, and E. Baby, sun cancer. Sun cancer. Skin cancer from the sun, whatever. Here we go. The A is asymmetry. In other words, the mole that you looking at or I'm looking at is big on one side, kind of smaller on the next side, but it's all in one mole. Like some of it's raised, some of it ain't, some of it's flat, some of it ain't. Asymmetry, right? Border for B. The B is for border. The border is irregular. It's not a perfect little circle necessarily. It could be, and it'd still be some bullshit, but the border is often irregular. The C is the color. I have seen 2 or 3 different colors in one damn mole. Green, blue, gray, brown, all in one mole now. That's crazy. Diameter. That pencil eraser that I showed you, 6 millimeters, that's the size a mole better be or less. So anything 6 millimeters or higher needs to be biopsied. The E I teach you is for evolve. That's what it really means. But I always say eraser tip of a number 2 pencil, so you remember it. Evolve means it's changing. That young lady that I lost, 27 years old, to malignant melanoma, her mole started bleeding out the blue. And I had told her to remove it years ago, but it started bleeding and it wouldn't stop. Like it would stop and then it would start and then it would stop and then it would start. It would stain her pants. It was on the inside of her kneecap and it would stain her pants and then it would stop and then it would, you know, the next couple days later, start back to bleeding with no bumping of it or nothing. Evolving. Maybe it has a hair and it didn't have a hair before, or it didn't have, you know, it had hair and the hair is discolored. Evolving. Evolving just means changing. Get that shit checked out. Okay, so that's what that is. Now, again, testicular cancer. I put TSE, testicular self-exam. This testicular self-exam needs to start at age 12. You got a son? You love him? You don't even, you say you don't? Oh, well, that's another story in another class. But if you half-ass like, and you definitely love your son, start his ass at 12 years old in the shower, taking these fingers, feeling his testicles for hardness. Like, seriously, guys, cancer is both painless and hard in many, many people. Let me say that again. Cancer is both painless and hard, very often irregular bordered, in many people. So he's feeling his testicles to test, to feel whether or not there's some hardness he feels. It's very serious. If he does, he needs to tell his parents, you, daddy, somebody, and y'all both need to get him some care, because this, again, is increasing in young people. Oh my God. Okay, now, so that's that. Now let's go over here to the cancer screenings that you're probably more familiar with. These cancer screenings are from 40 to 70-year-olds, and you know them well, but let's talk about them because some changes have occurred in some of these screenings. Breast cancer, self-breast exams every month, everybody knows, fill yourself up, child. But the mammogram needs to start at age 40 and go every 2 years, or depending on your risk, it may be every 1 to 2 years. That's important. If you're high risk with a first-degree relative, and a first-degree relative is mom or dad, because men can get breast cancer, mom, dad, daughter, son, sister, brother. Those are all first-degree relatives. If you have a history of that, you're considered high risk. You're going to need to start screening earlier, and depending on what your doctor says, maybe more often, or using different techniques and procedures. Also, if ever in your family or you, there was a diagnosis of breast cancer before age 50, that cancer is usually very genetic. So maybe there's a positive BRCA gene, BRCA, positive BRCA gene, which would be really, really, really genetic. And so if that person has a family history of someone diagnosed with breast cancer before age 50, they are at super high risk for this breast cancer, because that's a very aggressive and oftentimes genetic breast cancer before age 50. Okay, now colorectal cancer. This is my department. I work in endoscopy. I told you before, no weekends, no holidays, straight day shift, whatever. I love it. I can't imagine how my life would be if I didn't work in endoscopy, and I absolutely enjoy every single day I work. Now, so colorectal cancer, you have lots of different ways to screen for this, but let's go to tradition, okay? Starting at, and you guys know, our Black Panther star, he got and died from colorectal cancer, and then people woke up like, oh my God, he was so young, I can't believe he died from that. Well, now you know that this is something that we need to pay attention to, and the age did go down for screening. We would like our patients to start at age 45 and get a colonoscopy every 10 years, unless they have higher risk. Higher risk includes maybe they have Lynch syndrome, which is a genetic type of colon cancer, Lynch syndrome. Maybe they have something like previous polyps that were concerning, then they would come more often. But the regular Joe Blow is every 10 years, starting at 45 for colonoscopy. Now, you have lots of other ways that we are using to screen, not necessarily diagnose. No. Screen for colon cancer. One is called a FIT, F-I-T, FIT test. It's done in the home by you. You take the stool sample, do what it tells you, send it off in the mail. The other one that I've done personally, thought it was great, very reassuring, is a Cologuard, which is that you poop in the little hat or bucket or whatever it is, and then it literally checks for DNA, which is really kind of nice. Now, both of these have a little bit of a false positive, but guess what? They're better than nothing. The screening test that works the best is the one you actually fucking do. Hello. And I found this to be very easy, okay? And it's every 3 years for the patient who's low risk, right? And then, of course, the colonoscopy. Now, I want you to stay tuned, because there has just been lots and lots of information on the upcoming blood test for colon cancer. And there's going to be a multiple blood test for several cancers coming out. And I'm happy to say that if you vote, you can vote for the people who support Medicare and Medicaid covering these tests. I'll just say it's not the orange guy. All right. Now, then we have lung cancer. When we look at lung cancer, this is a very big deal because 7% survival rate is pretty shitty. What that means is if you look at two different very common cancers in America, breast cancer and lung cancer, they're worlds apart. Let me explain. We look at a 5-year survival rate, meaning from the day you were diagnosed with this cancer to 5 years out, who's still living. When it comes to breast cancer, we got so good at this that 90% of women are, men and women, are still living at 5 years. Not so with lung cancer, because typically lung cancer doesn't have any symptoms until it's too late. And by the time you have symptoms, it's stage 3 or 4, which is late. And by that time, your 5-year survival rate from the day you were diagnosed to 5 years later is 7%. Only 7% of people will still be alive. Now, come on, that's crazy. So we need to do better with lung cancer, and we can. The problem is that lung cancer kills more than prostate, breast, and ovarian all put together. Like it kills more. Hello. Now, so why do I get real passionate about this? Because somewhere along the way, the word has not gotten out. Only 5% of people are taking advantage of this screening, and we need to do something about it. So it's all about teaching. When you teach better, when you learn better, you know better, you teach better, right? Once you know, you do better. Once you do better, you teach better. So let's start teaching, nurses. You got 5 seconds in the room with these people. Teach, please. Okay, so here we go. Lung cancer, any history of smoking, they did change the guidelines, by the way. Any history of smoking, or if you're a current smoker, you should have a low dose, hear me clearly, low dose CAT scan every single year, starting at 50 years old and continuing all the way until you're 80. Again, if you've ever smoked, or you're a smoker now, you get this low dose CAT scan. We're talking about 15 damn minutes, 15 minutes of a low dose CAT scan, CT, every year, starting at 50 to 80 if you've had a 20 pack year history. And that sounds confusing. So let me talk about pack years. If I smoke a pack a day for 20 years, that's 20 times 1 pack, 20 pack year history. What if I smoke 2 packs a day for 10 years? 10 times 2 is a 20 pack year history. What if you were like my parents and they smoked 3 packs a day for over 10 years? Ooh, so 3 packs a day for 10 years is a 30 pack year history. In other words, as long as it's a 20 pack year history or higher, you qualify for this. Prostate cancer. Now, prostate cancer has a very, very interesting background. Men were scared to death of hearing that they had it. They thought you're going to whack their ding-a-ling off or prostate off or whatever body part down there off, and they weren't going to be able to enjoy sex because I heard all these rumors about being incontinent of urine and not being able to get it up and keep it up and do it up and, no, that is not what's happening now. In fact, like my beloved father, not every prostate cancer requires surgery. And even those that do don't require the type of surgery that you might be afraid of or have heard about 50,000 years ago. So it is in every man's interest, especially Black men, because they actually died from this a lot quicker. They all need a digital rectal exam starting at 45 for regular men, all men, right? But 40 years old for African American men, because they are at very high risk of this being quite aggressive. Okay, so starting at 45 for everybody, a digital rectal exam. And by the way, while you're afraid to bend over and get your little butt checked, we women have been bending over, not even bending over, but squatting and lifting legs up in stirrups, getting our coochies checked every damn year for a while till they spread it out to 3 years. So don't nobody want to hear about how wimpy you are about not wanting to bend over and get your little prostate checked. Get your life together. Pray about it, shit, because you need this. And let me tell you why. The digital rectal exam, when we feel for your prostate, gentlemen, it's supposed to feel like a nose or like a, I don't know, like a, maybe a peach or something like that. No, not even that hard. Maybe just really soft, okay? But when we do this digital rectal exam, it's hard as a brick, okay? It's like a big freaking difference between cancer and not. Now, of course, if we feel a digital rectal exam that makes us think, oh my God, this is very hard to the touch, we need a diagnostic biopsy. It's not like I can tell you with the hand what you got. No. Digital rectal exam combined with a prostate-specific antigen or PSA blood test is very, very good information for whether or not you think you got this and whether or not we need to do more testing. So the blood test and the exam together are very good screening methods. And here's the deal. We've gotten so good with this that now if you look like you're getting into trouble or you've had a positive prostate cancer diagnosis in the past, like my dad, or we're watching your PSA levels and they're starting to go up, we can just do an MRI to figure out what is going on and get more information. This prostate cancer issue has gotten so much easier for our gentlemen, and I thank God for that. But they just need to go to the doctor, okay? And for that, we need health insurance. So again, are you voting? Are you registered? Did you check your registration? Did you know they're dropping people off the polls so that they can suppress you from voting because you're going to show up voting day, find out you ain't even on the polls? Hello, check your voter registration. This is all related to insurance. Very much related to insurance. And a lot of people have a lot of difficulty getting the type of insurance they need to be healthy. Now, I just gave you all the different screenings. I talked about some of the millennial issues and the Gen X issues. I hope you got a lot out of this. Deuces for now. I'll be back soon.